My name is Ailsa Milnes. I'm one of the ruminant vets with Boehringer Ingelheim Animal Health. And as part of our preventative message, we have the Calf Matters platform, and that's there to provide information about calf health and to support our calf health portfolio. So, I almost start at the end and sort of suggest that if you want to have further information about things I'm going to talk about or some of the resources we've got, then please do visit that site. So we've heard about the real importance of genetics and nutrition, and I'm going to speak briefly in the time we've got available about the final piece of that puzzle, which is disease. And Jessica's kind of set it up really quite nicely, because a lot of the things I'm going to talk about in a way are the other bit, where nutrition's really important, then obviously disease is too, because at the end of the day, what we're trying to do is get these the best out of the heifers and the calves that we have, and for that, then we need to manage that calf health and that calf itself very carefully. What we're aiming for is growth, and whether that's the heifer calf with an age at first calving of 24 months, or the beef animal, you need to get growth, and quite simply for that, you need to feed them, and you need to keep disease to a minimum. So disease will impact on the health and the welfare and the growth of that calf, and ultimately it's going to impact on efficiency and sustainability of the farm. So this is actually Jessica's data I'm quoting here, but I do it quite a bit, and I thought, well, I'll carry on. So as you can see from that, with 15% of live-born heifers fail to make their first lactation, which is quite extraordinary. And further work, and recent work, from Nottingham University, has looked at a very large data set, millions of calves from the BVMS data set, and that showed that on-farm mortality, 25% of deaths occur within that 3-month period. And the figures by that 3-month period are on average about 4%, with the dairy industry having a higher mortality rate. So, we know we've got a period which is really crucial that we can look at and try and reduce what's going on in that very crucial early stage. Okay, so what are the causes? If we want to look at the causes of mortality, I've got some data here which APH actually dug out for me, which was very good of them. And so it's a really robust data set. But let me generalize. You can see the list of usual suspects, and I'm going to generalize. But less than a month old, then we're predominantly looking at scour. And also lack of colostrum. So we talk about scour being an issue less than a month of age, and you can see that there's crypto as the #1 cause of mortality, and you can see rotavirus sneaking in there as well. But in between, we've also got some other issues, and that big one, hypogammaglobulinemia, I get my tongue around that, it's basically lack of colostrum, it's lack of antibodies. So colostrum, lack of colostrum will have a huge impact, as we know, and we'll talk about that a little bit later. But in that first month, you can see that's bearing out in the data that we have, in the death data that we have. If you move on to the slightly older group, and we're talking about 1 to 6 months of age, again, including this 3-month period that we're focusing on right now, then we've got pneumonia, and lots of it in all different types of shapes and sizes. But it's not just deaths that we're worried about, it's the impact. So with the other word we use, we talk about mortality meaning deaths. We also use this word morbidity, meaning numbers of animals affected by whatever disease it is. And that's important because disease has an impact on the growth and the productivity of those animals. And when we're talking disease in young calves, as you can see, we're talking predominantly BRD or pneumonia and scour. So particularly BRD has a huge impact on that growth rate, and it's really difficult to then play catch up afterwards. So it's important to use these early weeks as a launch pad so that you can get the calves off to a good start rather, to maximize the genetic potential and also to maximize the nutrition that you're feeding. So as I said, BRD in particular impacts on growth rates. It kills them, but it also checks the growth. And this is just one of the many studies that we've got, but this is, again, UK data showing the impact of lung consolidation, that's when it's really hard and nasty, or pneumonia, on growth and on the reduction in average daily live weight gain. And you can see from this that it, as you'd imagine, the more lung lobes you've got affected, the more impacts on growth rates. So 71 grams to 202 grams you can see there, which might not seem a lot, but if you're looking at your target being 0.7 to a kilogram a day of growth rate to get your targets of 24 months age of first calving, and you've got 200 grams, you know, it doesn't take much of a mathematician to work out that you've got a 25% loss, and therefore, you know, you are losing ground at every opportunity. So we talked about disease, and as I say, in young calves, we're really, I'm always talking about syndromes. I'm not going to turn this into a presentation on what types of diseases. Let's just talk about the two main syndromes, which are, as I said, were scour and BRD, and what that impacts. But in young calves, what we've got, it's almost an interaction. Vets love to use that word, multifactorial. But I think you can understand it. What you've got is a disease, the pathogen or the cause of the disease, but you've also got things that have an impact, a bit like a ball of string, isn't it? It's all wound up together. So the outcome in terms of disease is going to be an interaction between the cause of disease or the pathogen, the environment that the animal's in, and also how well the animal's immune system functions. And the other way of looking at that is to look at trying to the aims are to build a resilient, healthy calf, and to try to push the balance in favour of that calf, and rather than in favour of the pathogens that are either all around or are present on the farm. So welfare and productivity of calves can be improved by management strategies which are designed to improve that resilience and reduce the stress on the animal and push the balance in favour of that animal. The aim of the system has to be about proactive disease prevention rather than reactively responding, because then you're playing catch up and then you're onto a losing streak. So I'll just quickly sort of divert a bit into this idea that we have been talking about over the last year, which is called this Kaizen philosophy. You might have heard of it, but it's basically really part of overall total quality management. And again, I think Jess was talking about that as well. The idea being that if you've got a growth rate problem, a disease problem, then you need to look at the whole system, especially when we're talking about these young calves, when we know what our two issues are. And what we're trying to do is look at that whole system and look at continuous improvement. So you need to have a plan in place. You need to know what your system does. You need to make measurements, so check that it's working, so have some objectivity in it, and then make some tweaks to change things. And this methodology is used a lot in business and various processes, and as you can see, it was used a lot in the car industry, but it's equally applicable to farming. So just a quick reminder, so we're talking about this multifactorial impact of disease. We've got our pathogens, we know that BRD and scour are really important, but it's an interaction between the calf's immunity and its environment or the system. And so if we're looking at the environment, then the three main areas, when we're talking housing, will be hygiene. That's obviously important. It's important for any disease process. So hygiene from the pathogen's point of view, if you've got a very hygienic system, then you reduce the likelihood of the pathogens, whatever they are, staying around in the system to challenge the animal. And therefore, you're hopefully meaning that the animal's not going to be overwhelmed. But it's always part of that, as I say, that mix. The other bit is fresh air, especially with pneumonia. We're really, really keen to make sure that the animal has access to fresh air, but at the same time, reducing the impact of drafts, which can act in a negative way, especially with young animals. And we're also talking about moisture as well. Again, that interacts with in the environment in a detrimental way from both the animal's stress point of view, because it gives it an environment that's not brilliant, and also from the pathogen's point of view. So really, if you're looking at, like we showed at the beginning, like crypto, for example, little tiny parasite, which is the number one cause of scour, it loves unhygienic environments. It will thrive well in unhygienic environments, as will a lot of pathogens, and that moisture as well aids with the survival of your viruses and your bacteria. And temperature. Again, it mixes into the environment for the pathogen, but equally, as I'll talk about, and Jess has already talked about, it has a really important effect on the calf, especially the young calf, because they are extremely sensitive to temperature. Now, we talk a lot about ventilation and this fresh air, but I'll just quickly, briefly talk about that. So the aim is to provide adequate fresh air without exposing the young calf, especially to drafts. And natural ventilation relies effectively on the stack effect. So what you're trying to do is to have this chimney effect in the building. Most of the time, as you know, the wind itself can drive air changes within the building. But if not, then you're relying on the stack effect. And that's where you have the animals producing heat. That then means that the warm air rises, filled with the pathogens that they're braving out, and cool, fresh air is drawn in from your adequate inlets. Now, the downside is that realistically you need some heat in that building to drive that. And young calves are not ruminants. They don't produce that level of heat. So again, you've got issues where you have problems with young calves in what appears to be a very good, well-ventilated environment, but they simply can't shift it. So in those areas, what we can be looking at is, and many people have, is the introduction of some mechanical ventilation to make sure that you're allowing adequate fresh air to come in, and to make sure that, again, that the calves are not exposed to drafts, so that you're not using things like the side door to be your supplier of ventilation, because that's when you have issues with drafts. I think Jess covered this off really well, but temperature, and we're being much more aware, I think, of temperature, is really critical, not just from the pathogen's point of view, so that you have a nice area that the pathogen can survive well in, but because of the calf. So ruminants, you stick them out on a hill and they cope very well, but baby calves are not ruminants. And the lower critical temperature, as we've heard already, is practically tropical. It's 10 to 15 degrees C, which, if you think about this country, we don't see that too often. And obviously, a bit like everything, it's affected by other environmental factors like drafts and moisture. So if that calf is having to expend energy simply to keep warm, then that energy is not going into growth, and it's certainly not going into its immune system. So you've got effectively cold stress. And the temperature, the lower critical temperature, as I said, is affected by various things. So again, back to your environmental factors, if you put inadequate straw, or you put the calf in wet straw, or your drainage isn't right, then you're going to mean that the calf's lower critical temperature is higher than it should be. And equally, cold, damp concrete. And you know yourself that if you're in a damp environment or a cold building, it's not good. You can feel the cold much more. It gets right into your bones. And this impact of temperature on calf health is something that we're being, it makes common sense, but we're being brought more aware of from research from both Nottingham, which is the slide here, and also from the Royal Veterinary College, where they've shown that mortality increases in cold temperatures. And so they've shown a direct correlation between deaths on farm and the temperature, with reduced temperatures associated with increased mortality. And if you were to replicate the optimum environmental temperatures, then the mortality in those calves could be reduced by 2%, which is shown on the slides. And what that equates with this data set was the potential to have about 37,000 fewer deaths, which is a huge welfare issue, as well as having those financial implications. So realistically, back to those things, we know that temperature's got an impact on the calf's health and on its mortality. So there's things that you can then do. If you know that, then you can do things about that, whether that's bedding, whether that's calf jackets, whether it's using heaters, but making sure that the microclimate that is in the calf house is suitable for that calf, so that you're making sure that you're helping the resilience of that calf, and you're not making it be subject to cold stress, which, as I say, is hugely detrimental. So we talked a little bit about pathogens without turning it into a gory presentation on what does what, but scour and pneumonia, they're fairly ubiquitous causes, and they're present on most farms. Talked about the environmental factors, and then I just want to finish off on immunity. And what can we do for a calf's immunity? And I think we've already kind of chatted a bit about that earlier, because colostrum is probably the single most important thing that we can do for the calf. It's absolutely essential. And also vaccination, which I'll talk about a little bit as well. We want to reduce stresses, and I know it's a big topic, but realistically, it's about producing the best possible environment. We know, for example, that animals kept in good conditions, born in the sort of warmer months, fed well, and having adequate colostral antibodies, they do better. So all those things are important, and we have to mix them in together. But I'll just talk a little bit about the biological side. So Jessica talked about the importance of the 3 Qs and getting things in. But why is that? Well, the cow's placenta acts as a barrier, and it separates the maternal and the fetal circulation. So it's not like a human placenta. And therefore, those antibodies aren't able to pass between the mum and the calf before birth. And that calf is therefore born without a functioning immune system. And so they're very dependent on that transfer in that window. And what you've got is a neonatal animal, a little baby animal with not much of an immune system, dropped into a farm environment. And that's when you can see why the environment's so important, why the hygiene is so important at that point of time. To get that colostrum in, it has a short window. The gut is only open for a very short period of time. Now, that gut is open to these large immunoglobulin molecules. They're much larger than other molecules, but it means that the gut's also quite porous and also open for bugs and pathogens to come in. So again, hygiene, not just in the environment, but in the harvesting of the colostrum and in the storing of the colostrum and in the giving of the colostrum has got to be really essential, because, as I say, you've got an open gut, an animal with no immunity, and also you've got that navel sitting there waiting to act as a portal of entry for disease. So get the colostrum in, have the best possible environment that you can, that the calf is born into, so that your maternity ward is as clean as it possibly can be, and get that navel dipped and dried off as quick as you can. And we know, it doesn't take a rocket scientist or whatever. There's lots and lots of data out there to show that if your calf doesn't end up with colostrum, if you don't kickstart that immune system initially, those are the ones that end up in the postmortem room. Those are the ones, as is shown right from the beginning, those are the ones with the hypogammaglobulinemia, number 2 cause of death in calves less than a month old, and that's the ones that are shown through the PM room. So those are more likely to end up dead. And we've known about this, we've known about all this stuff since I qualified, and we used to talk about 6 pints in 6 hours. But but there's lots, as Jessica's talked about as well, and the logistics of getting that absorption into the calf. There's lots of things that can go wrong: timing, quality, all those bits. And therefore, we know that it's a really good point that farms can look at and see what's happening with them. Are they managing it themselves? And the recent data we've got suggests that, despite maybe best intentions, it's still not all calves are getting that really good start. So a study from RVC showed that 21 calves had failure of passive transfer. And a study by Owen Atkinson on I think 70 dairy farms suggested that 52% of those heifer calves had adequate colostral transfer, which means that 48% obviously didn't. And it's not just the dairy herds. Recent work's been looked at in the beef sector, showing that 1/3 of herds had more than 20% of calves with failure of passive transfer, and so that's in the calves, that's in the herds. And then at a calf level, 18% of the overall group that were monitored had failure of passive transfer. So that's a sort of obvious first step. Are my calves getting the colostrum that they need? Moving on to what else we can do besides the colostrum, obviously vaccination. Vaccination itself, coronavirus, we're all much more aware of the importance of vaccines. Hopefully we're all aware that it's not just hocus pocus. According to WHO, it's the single most important thing, apart from clean water, that's happened with human health, much more so even than antibiotics. But it's not a cure-all in a bottle. It's used basically as part of a controlled strategy to try and reduce the impact of disease. And the slide I'm showing here is from Owen Atkinson's work, which was done on those dairy farms in Wales fairly recently. And what he was looking at was heifer rearing. And this is a sort of summary slide which shows that it's 8 months of age. If his target was weight, he was looking at comparing farms where they vaccinated and farms that didn't. And you can see he's categorized it into 3 categories, where no pneumonia vaccines used, where some receive vaccine, and where the whole calf group receives vaccination, or they use it all the time. And it's that group that you see a big difference, 274 kilograms versus 227. Now, what we're not saying is that vaccinations caused all this, but what we can maybe summarize is that maybe the farms that are using vaccination all the time are the ones that are using it as part of that strategic message, part of that way to try and improve health. Maybe they're getting the colostrum right as well. What can we say about the ones that just maybe use vaccination some of the time? Again, I'm making my own assumptions. I'm probably Owen did too. That are those the farms that where they've had an outbreak of pneumonia, they think, yeah, I'll use some vaccine, and then pull back from using vaccine once the coughing stops. So in other words, are they the ones that are using it in a reactive measure rather than a proactive? And that goes back to this idea that what we're trying to do is proactively prevent disease, and that's where we get our best results from. I'm not going to talk about vaccines. We obviously manufacture vaccines, but it's about that discussion with your vet and knowing your system. So again, back to that whole stuff about the Kaizen discussion. Know your own system, know your pinch points, know when you're getting your issues and what the diseases are that you're getting your challenges with, and then make that vaccination program to suit you, and work with your vet as well so that you can get the best advice from them, and get the best out of it. Okay, so in summary, as I say, this is a sort of third piece of the jigsaw. You're trying to make sure that you get the best out of these calves. So you've got the genetic potential initially, and then you need to feed them, and then you need to try and make sure that you're reducing disease, because that's critical for efficient farming and for sustainability. 2 main syndromes, scour and BRD. And they are very important, especially BRD in the early life, as it impacts not just on the mortality figures, but on the long-term growth. And as Jess has talked about, all those targets that you need to get the target that you want at the end of the day. You need to understand the system that you're working with. It's, identify where maybe your weaknesses are, using that idea of that Kaizen philosophy of knowing, having a plan, recording your data, using that data to benchmark against yourself, showing where your pinch points are, showing where you can make those improvements, and making those improvements. Communication is really, really important so that everybody on the farm team is singing to the same song sheet. It's absolutely, so, for example, the calf shouldn't know who's dealing with it. There should be a system in place because they don't like variation. But as I say, communication is key so that everybody knows what you're trying to do and what your plans are. Also with the farm team, and also with your vet. And again, bringing in your vet so that you're working with them for prevention and not just treatment. You want to make sure that you're trying to proactively prevent disease, because that's what's going to save you money in the long run, and it's going to save you in welfare issues as well. You want to keep monitoring, and you want to show the benefits of those improvements so that you can feed those back in, and that you can motivate the team and motivate yourself. And I think that's it. So thank you so much for listening. As I say, if you want to look at Calf Martyr's website, please do. There's some further information there.